Well, due to the prevalence of fibroids, it's interesting that a number of my patients of African American descent will have fibroids diagnosed in pregnancy. So I often will step back when I see that on an ultrasound report and take a moment with my patient to explain to them what fibroids are, because they may not have ever been told before this pregnancy that they have fibroids. But I also tell them that in the setting of pregnancy, most people, especially when they're smaller fibroids and incidentally diagnosed, will not have complications due to fibroids in pregnancy. I do warn them though, fibroids do increase your risk of postpartum hemorrhage in pregnancy and malpresentation, so a baby could be more likely to be breached or irregularly positioned by the end of the pregnancy if a person has large fibroids. But again, smaller fibroids are not something that often will impact a person's pregnancy or their delivery. But I think it's important to take a moment and explain it to the patient regardless of the fact that they may not have symptoms or complications. Because just because we see fibroids all the time and know that they're probably going to be less consequential for that patient, this is their first time hearing that they have fibroids. So stopping telling them that they're benign growths, that 70 to 80% of women will have them by the age of 50, and that most people don't have symptoms or complications due to them will not only keep them informed about their health, but it will also hopefully quiet some of their fears of now learning that they have fibroids.